This eHIV Review Patient Voices program is presented by DKB Med Radio. HIV and incarceration. For many LGBTQ+ people living with HIV, the criminal justice system can be the end of the line, a steel-barred cage that separates them from the physical and psychological care they need. But for others, it can be a wake-up call to a much different future. This issue of Patient Voices is a companion piece to our recent eHIV review publications on overcoming post-incarceration care disengagement, authored by Doctor Asa Clemenzi Allen of the University of California, San Francisco, and the San Francisco Department of Health. Our Patient Voices host is Justin Alves, a nurse and nurse educator at Boston Medical Center and one of our eHIV review program directors. Our guest today is Blaise Conway, a person living with HIV who's had direct experience being inside the criminal justice system and who's transformed his life from addiction and incarceration to sobriety and helping others regain control of their lives. He's the program director of Greater Boston Addiction Centers and Greater Boston Behavioral Health and the founder of the Society House, a 12-step sober safe house focused on the needs of the LGBTQ+ community. And now, Patient Voices.
Hi, everyone. My name is Justin Alves. I am the host and program director for eHIV Review Patient Voices. And I am joined today by Blaise Conway, who's going to be talking to us about HIV and incarceration. Blaise, do you want to take a minute and say hi and introduce yourself?
Hi, Justin. How are you doing? Thank you so much for having me on this program. It's really an honor to get to share my story and talk a little bit about my experiences, having gone through the legal system and what that was like a little bit and what it was like being a person with HIV going through that as well.
Yeah. So now before we get into sort of the heavier stuff, I'm hoping that you can tell us a little bit about like where you are now, because I know when things get sort of, we talk about the heavier things, people need the light at the end of the tunnel. So do you want to give people a little glimpse of where you're at now?
Yeah, absolutely. It's like getting to eat dessert first. My name's Blaise Conway. Today, I'm the program director of Greater Boston Addiction Centers and Greater Boston Behavioral Health. I have been sober from crystal meth for over 5 years. And I just recently opened an LGBTQ sober living home in Weymouth, Massachusetts, which is kind of the first of its kind in the Greater Boston area. And so I have recently joined the Ryan White Council and have really started to try to get out there and start to give back to the community.
Yeah, and that's great. And I think that that's a great sort of place to start, to know that things do get better. And so now I want to talk a little bit about if you can elaborate on what it was like to be somebody who was involved in the carceral system and living with HIV.
Absolutely. Like I had said, I have been sober for over 5 years, but I have struggled with drugs and alcohol from around the age of 15 until I was about 30 years old. So during that time, my life hit many dark places. And there was a lot of stuff that went on due to my addiction, which ended up with me getting arrested, getting into some trouble, and having to do some jail time here and there. I believe the first time that I went to jail was when it was back in 2014 or 15. And at that time, I was just a drug addict. I had not been diagnosed yet. So when I had gone in there, I had kind of already known that when you go into the incarceration system, that you don't get psych meds and things like that. They kind of give you only the things that you need. Well, that was as far as what I knew. I believe that I was diagnosed in 2017 with HIV, and I had found that out right after getting out of jail. And unfortunately, I found myself back in jail shortly afterwards. And going into jail as a gay man is anxiety riding anyways. Especially, when you're younger and you're insecure and you're going into this like scary place that you feel like is very dangerous and is very misunderstood. To be queer in the incarceration system is enough struggles of its own. And then to have to share that you have, that you're HIV positive and that like you need medication. Sometimes it's difficult to feel heard. And not only feel heard, to feel understood is also another big difficulty. So to be able to share that and get the appropriate medications requires a lot of self-advocation. And when you are in the incarceration system, you're not taken seriously. No, so like I'd say that most people aren't taken seriously as an inmate. So to then go self-advocate for yourself and be able to like prove that this is something that's important and is something worth taking the time is a whole other struggle of its own.
So, Blaise, one of the things that you've mentioned is that you actually have been incarcerated more than once, which is pretty common in my experience. And so I'm wondering if you want to mention or talk about why you think that happened and what would have stopped you from like a recurrent carceral sort of stint.
So, like I said, I struggled with addiction for about 15 years. And crystal meth was my drug of choice. And there wasn't a lot of resources for crystal meth treatment in this area of the country. It's still something that there's not a lot of resources in. So I don't feel like I was like necessarily given the appropriate resources to take care of that, because a lot of the recovery and the treatment and the resources in this area are geared towards alcoholism and opioid abuse, which one might argue that like a drug is a drug and like addiction and treatment is all the same. But especially being like a gay man addicted to crystal meth, there are a lot of nuances that come with that. And there are a lot of things that people don't feel comfortable talking about and people just kind of brush under the rug. And because of that, I don't think that I was given necessarily like a fair shake in the beginning to take care of these things. So I found myself trying to do things on my own and come up with my own resources. And a lot of times I succumbed to the temptation of what was easier. And for me at the time, it was easier to give in to these feelings, and it was easier to just go out and get high. And, like I said, I was homeless for a long time. And so I found myself in a lot of predicaments that ended up with some trouble with the law.
And so I'm just thinking about, for the providers who are listening today, who may be taking care of folks who are just out of jail, what are some things that you wish that they knew that maybe would have changed your story sooner if they were able to sort of accommodate what you needed when you were out of jail?
So I think that a few of the things, so like when so back in like 2017, addiction treatment and mental health services were dealt with completely separately. I think that today that there's a lot of better resources for people struggling with mental health. But when I was going through it, you were kind of put down a path of either substance abuse or mental health. And if you were going down the substance abuse path, a lot of the resources utilized for mental health help are not for substance abuse. So a lot of like medication management and things like that. It became very difficult for me to find a house that would comply with my medications or that would allow certain things because of the like very strict, very abstinent-based 12-step road, which I do agree works. And that's something I utilize in my life today, in collaboration with other resources and other therapies available.
So really trying to meet your needs when you come out, both from a substance use standpoint, from an HIV standpoint, from a mental health standpoint.
Of course, yeah. I mean, because it's such a fully rounded thing that you're trying to take care of. When you get out of jail, or at least when I got out of jail, right? I had nothing. I had absolutely nothing. I had, I got out of jail. I have no insurance. I have nowhere to go. I have nowhere to stay. I have no money. And I'm told to just like go run around and find all these resources on my own. And while like you can absolutely do that, but when you're trying to start your life over, it's very overwhelming. And I think it feels like the system wants you to fail. And it becomes very hard to stay motivated and get yourself out to all these places. So when someone's first coming out of jail, there's a lot of work that needs to be put into giving them the best opportunities to not reoffend and not go back.
And I think that the work that you do now in your treatment program with your sober home, I think that you do a lot of the work. And so I just want to thank you for the work you do and for sharing your story with us today. I think it's powerful for folks to know that it can work and things can change. So thank you so much for being with us today.
Absolutely. Thank you so much.
For eHIV Review Patient Voices, my name is Justin Alves.